Hi, good morning, everyone. So if you suffer from a stuffy nose, if you suffer from a runny nose, if you wake up feeling fatigued throughout the day and that fatigue stays throughout the day, if you constantly wake up with puffy eyes and this thick crust, between your eyelids, if you constantly chronically have a cough that's not going or a sneeze, and then we have sinus, we have asthma, we have all of these breathing problems, or if we're constantly taking our children to the doctors because they constantly keep having colds and coughs, or even as an adult, there's some root cause that we need to start addressing, because although medicines will help, it is not addressing the root cause. It is only addressing the symptom, which is why we got to keep on taking medication and keep on visiting the doctor over and over again. So today we're going to have a look at something which is the underlying effect of all of these things. As usual, we need to understand how the human body works. So let's start. As a child, let's go back to when you were a child. After you finish breastfeeding, the first cooked meal that you ate began the formation of mucus in your digestive system. This mucus is good for you because it lines your stomach lining and prevents the acid from your stomach from affecting your stomach lining. Now that mucus is good for you. Any excess mucus then comes back into your lungs, and from your lungs it comes out of your body. Now the problem is the lungs are not designed to hold mucus. They are never designed to hold mucus. So what happens is your lungs have this natural self-defense mechanism to push that extra mucus through your throat and then out of your nose. So when our kids or when we as adults have a runny nose, it is nothing but your lungs pushing out excess mucus. So now let's go back to a simple case where your child or you have a runny nose. That means, number one, you have excess mucus in your lungs. Now, how do you have that excess mucus in your lungs? Because your stomach and your digestive system is producing excess mucus because of the food that you are eating. So when we constantly eat foods which are rich in oil, which are rich in sugars, which are processed, which are manufactured, these are mucus producing foods. And at the end of the video, we're going to understand the solution for this. So the more you feed your child or yourself sugar and junk food and foods which are not natural, the more your digestive system will produce mucus to protect itself. Now, we all know what happens with that excess mucus. That mucus comes to your lungs. And now your lungs has to push that out. It has a natural function like the intestines called peristalsis, where your lungs will push out that extra mucus because your lungs can't live with that mucus. We all know people who are sick and people who age who have excess mucus in their lungs. They need to get it tapped out because that mucus later becomes water, and then you have water collection in the lungs, and that's a serious issue. But we're going back to the basis of the lungs pushing out mucus. So now all of a sudden, your child or you have a runny nose and you go to the doctor. So the doctor gives you some drops or some medication to stop the runny nose, which your lungs is naturally trying to detoxify. So we take this medication, which may be necessary in most cases. Now what happens is the runny nose stops because all the energy used by your lungs to detoxify the mucus now goes towards cleaning out the toxins created by your medication. As we all know, every single medication leaves a toxic residue in the human body. So the runny nose stops because the body's diverted all the energy to clean out toxins from your liver. It requires a lot of energy. Now, once all the toxins are cleaned out, your body can restart detoxifying. So what does it do? Again, it starts pushing out that mucus from your lungs through your nose. So a week later or a month later or 2 months later, again your child has a runny nose. Again, you take him to a doctor, and now he may get a stronger dose of medication. So you see, the symptom gets treated, but the problem reoccurs. But what is the root cause? Your child's diet or your diet? Mucus-forming foods. So if we change from those mucus-forming foods, we won't have mucus in our lungs anymore, which means we stop the problem of a runny nose, which later becomes a cough or a cold or a sore throat or a viral. Now let's have a look at your lungs again. You see that you have mucus which is colorless, and sometimes it becomes green and yellow and brown. Your mucus is getting infected with bacteria. Now, in most cases, or in some cases, the body again has a self-defense mechanism. It's called pneumonia. Pneumonia will push your lungs to detoxify all that poison mucus from your system. But then we have a whole different allopathic treatment for pneumonia, where the root cause again is mucus. And if we're not addressing that cause, the root cause of mucus, we just continue taking treatment and getting sicker and sicker and sicker again. Most allergies in children and adults, the allergies is the constant buildup of mucus in your body, which is why asthma and sinus makes it difficult for you to breathe, because there's so much of mucus that your nose is constantly blocked. You constantly have a chronic cough. Why do we cough? Self-defense mechanism of the human body to try and force mucus out of your system. So you see, the body's constantly trying to help you to stay healthy. But then we get that medication in place and we only treat the symptom. Take the medication if you need, but also make that lifestyle change to make sure that you address the root cause. Let's talk about fever again. Fever is the brilliance of the human body trying to protect you. It is a symptom of the human body trying to protect you. The human body uses so much of energy to raise its temperature to kill certain pathogens, certain viruses, certain bacteria. Fever is a way of detoxifying your body. Your body becomes hot because it needs to produce a sweat. When you sweat, the body is releasing toxins. The sweat that you have during exercise is very different from the sweat that you have when a fever breaks. You will see that the sweat is slightly slimy because it has a lot of toxins that the body is detoxifying. So again, fever is a way of elimination, detoxification. Now we got to be very, very careful, because fevers which are caused because of malaria, dengue, swine flu have to be treated no matter what, because that can kill you. I'm talking about regular fevers that we get and we react. So now when your body uses all that energy to raise its temperature, your heartbeat may increase by 20 to 30 beats per minute. Your hormones work twice the more your hormonal glands to produce hormones to help this fever protect you. That's why we feel so tired and drained when we have a fever. We want to relax, our body pains. It's forcing us to rest because it's using all the energy to raise your temperature. What else happens when you have a fever? Your nose gets blocked so that you don't get smells of food anymore, so that you don't have hunger cravings. If you notice your tongue, you'll have a thick coating of mucus that blocks your taste buds, so you don't have that constant taste and craving for food. In most cases of severe fever and colds and virals, your glands in your throat will also swell up, which makes swallowing difficult. So your body is literally trying to shut down your digestive system and helping you by curbing your appetite, which is why most of us lose our appetite when we fall sick, because a lot of energy is used to digest food, and you don't want to be using energy to digest food. The body needs energy to raise your temperature and use your immunity to protect you and fight all of those germs and bacteria in your system, which is why fasting or lowering your calorie intake when you are sick, which the body naturally does, but we feel sorry for ourselves, we pick up the phone, we order some food, or we eat more food. Or most parents will tell their child, oh, you're sick, please eat, please eat, please eat. But you will naturally see that your kid does not want to eat, and you must respect that. They're not going to die of hunger. They may lose a little bit of weight, but they are going to come out stronger and healthier. So do not force them to eat. You have to understand that your body is doing the right thing at the right time for you. And then we have all these worries and fears induced by doctors and the whole media where, oh, but if the fever goes too high, it can cause brain damage and there'll be convulsions. You have to understand a fever-induced convulsion is the body shaking to dissipate the excess heat. It's as simple as that, which is why in the olden days, moms and dads would wrap their child up in a blanket or put them into a bucket of cold water or lukewarm water, depending on the kind of fever, and help the body break the fever naturally. So, we have to stop making decisions from a space of fear, but start making decisions from a space of logic. Because then when we take that aspirin or that paracetamol or that Tylenol, we have sabotaged the body's detoxification system. And yes, the fever will come down. Your body will divert all the energy to clean out the toxic residue of the medication you took. And once that's done and your body starts detoxifying again, all those symptoms will constantly keep coming over and over again. So if you want to do a test to see how much of mucus you have in you, okay, do a short run. If you have a runny nose after the short run, that means you have a lot of mucus in you. If you don't have a runny nose, that means you don't have too much of mucus in you. That's the simplest test that we put athletes through and pro athletes through as well, to check how much mucus they have. Because if they have mucus, it interferes with their VO2 max, or the ability of the body to utilize oxygen. So then we sort out the mucus problem so they have more energy and stamina to do their sport or to do their run. Now let's get to the solution right now. It all comes down to diet. We have to understand that mucus is important for the human body. The human body produces mucus in your eyelids, in your respiratory system, in your lungs, in your digestive system, between your joints. Mucus is required to protect your mucosal membranes. Like, for example, if you don't have mucus in your stomach, the acids from your stomach will wipe out your stomach linings, giving rise to ulcers, acidity, acid reflux, and all of that stuff. So again, if you watch my video on acidity, there's a direct connection between acidity and mucus. Your body, if it's acidic, will produce more mucus to protect itself naturally from the side effects of excess acid. So the more acidity you have in your body, the more mucus you have in the body. The more mucus you have in your body, you know what you're going to have. Low immunity, a slow lymphatic system, a poor respiratory system, and again, all the problems that we commonly experience: colds, coughs, runny noses, virals other than, malaria, dengue, chikungunya, and all of that stuff. And we constantly have low immunity. So what's the first thing that we do to prevent or heal if we already have the condition, be it asthma, be it sinus, all of these conditions? We change the way we eat. We do away with foods that are mucus forming. Now, these foods are your sugar, your junk food, wheat, dairy. The first thing you do when someone's got sinus, asthma, colds, or coughs, you remove wheat and dairy. And here's the logic behind it. Wheat and dairy require a lot of stomach acid to break it down. It's hard for your body to digest dairy, and it's hard for your body to digest wheat. So you need a lot of stomach acid, which produces a lot more mucus. And now you see you have undigested wheat and dairy molecules in your body, natural self-defense mechanism of the human body. Your body will produce more mucus to protect itself from these food molecules which are undigested. Let's go into your digestive system, your small intestine, where 80% of absorption of the nutrients from the food that you eat happen. Your intestines have millions of little tentacles called microvilli. And these tentacles suck in nutrients from broken down food into your blood, and your blood carries oxygen and nutrients to all of your cells, feeding you and keeping you healthy. If you have too much of mucus in your small intestine, it forms a gel-like solution, blocking these millions of tentacles to absorb food. So you all know people who eat so healthy and yet they're sick, yet they have low immunity. That is the reason. So when we're looking at boosting immunity in your children, in yourself, the first thing is reduce acidity, reduce mucus. So wheat and dairy are the first two things that you cut out. Deep fried foods and oily foods, which is why go back to your normal local family doctor decades ago who would ask you, you have a cold and a cough, they would take a little hammer, knock you on your knees, knock you on your elbows, press against your liver to check for inflammation, look at your tongue and tell you reduce oily food for the next 2 weeks, because oily foods produce more and more mucus. And today all you get is a prescription with an antibiotic which is missing a probiotic, which makes more and more damage happen to the human body. Alcohol, caffeine, cooked food, processed vegetable oils are all mucus forming, which is why here is the solution. If you want to boost your immunity, if you want to solve, if you want to reduce your asthma, sinus, and all of these things, your diet should be 80% raw and 20% cooked. Look at the natural instincts of a child. Most children naturally take to a fruit, but when we give them the taste of chocolates and sweets and processed foods, where companies spend billions of dollars in getting that taste so addictive for the human brain, why will they look at a fruit once you've given them a taste of all the chemical crap in it? But if you give a child a fruit, they are more than happy. So if your child is sick, if you are sick, make a dietary change right now while you're sick. You can eat cooked food, there's no problem with that, but most of your enzymes, vitamins, minerals, and the whole alkaline levels should come from your raw diet. So give your child fruits for breakfast, fruits for lunch, fruits for dinner, raw vegetables like carrots, cucumbers, nuts, seeds, and give them a little bit of cooked food as well. But the proportion has to be more raw, less cooked. And I can promise you, your child will start healing. I can promise you that you will start healing. And why can I make that promise? Because then you give your body everything it needs to protect you and do the right thing at the right time. What are the best foods for you to consume if you have a lot of mucus in your system? Turmeric, ginger, garlic, all of the citrus fruits. And then you have your raw vegetables like carrots and cucumbers. So basically it's again everything that nature's given you, which is wholesome and raw. It gives your body everything it needs to do for you at the right time. Remember, whenever you have a symptom, Okay, look at it in a positive way. The symptom is your body doing the right thing for you at the right time. So this is the way you have to look at your life going forward and the life of your kids, because we have enough of medication, we have enough of pills, we have enough of all of this, and we have a sicker country, sicker communities, and sicker societies and families. So right now, it's time to make that decision. Take the medication when you need it. I'm not against it, but also get to the underlying root cause. Change the way your family and you eat. Change the way your family and you live, think, move, and sleep. And that's when you have healing. Have a great day, everyone. Until next time, eat smart, move more, sleep right, and breathe deep. And yes, you have that reset button in you, and so does your kid. Hit the reset button, make changes, and I can guarantee you, you'll feel better. And it's all about feeling good inside. Have a great day.